Hello, and welcome to today's lecture. We're going to be talking about the liver channel, the Fut Jue Yin. So the liver primary channel begins at liver 1. It's on the dorsal side of the hairy region of the great toe or big toe, crossing points spleen 6, spleen 12, 13, rin 12 and 3, 4, and PC 1. And then the Deadman also says D20, which is the vertex. Organs entered is the liver, gallbladder, lung, and stomach. The tissue is the eye system, neuropharynx, throat, and exterior genitalia. Linkage is liver to lung, which is the middle jiao. It encircles the inner surface of the lips. 8 Sun up across. 8 Sun up is where it crosses the spleen channel, right? So you're going to see a lot of questions revolving around where does the spleen channel and the liver channel begin to cross. And it happens 8 Sun up on the spleen channel. Liver physiology. It stores blood, assures the smooth flow of qi, controls the sinews, manifests in nails, and it opens into the eyes. It houses the hun, the ethereal soul, and it's affected by anger. So we're going to get into the liver channel pathology. Low back pain, fullness in the chest, pain in the lower abdomen, a hernia, vertical or vertex headaches, dryness of the throat, hiccups, enuresis, diarrhea, dysuria, and mental disturbance. Now notice that two things there are highlighted, the low back pain and the vertex headache. That's going to help you differentiate this versus, say, channel pathology of the UB. Channel pathology of the UB also has a type of occipital headaches accompanied by low back pain. So if you see fullness in the chest, that's the giveaway that we're talking about liver channel pathology. The liver low point is liver 5. It separates from the primary channel at liver 5 and connects with the gallbladder channel and ascends to the genitals. So it's very common to see liver 5 used for any STD, any problems with the genitalia, whether it's male or female. So it's very common to see this in the point prescription. The Shu symptoms is itching in the pubic region, itching in the external genitalia, herpes, eczema, candida, and vulvitis. Those are all your classic Shu symptoms. Then we also have the Sure symptoms, which is colic, swelling of the testicles, constant erection. So, at this point, if I were to ask you guys, what does Viagra do, long-term use of Viagra actually do? It causes a constant erection, which damages over time the ability to obtain and keep that erection. So then you would have to look at this type of pathology and realize that yes, liver 5 can actually help with that. The Sunu channel originates on the dorsum of the big toe, ascends to bind at the anterior aspect of the medial malleolus, proceeds along the medial aspect of the tibia to bind at the medial knee, continues upward along the medial aspect of the thigh to the genital areas where it connects with the other sinew channels. And then the pathology. Strains of the big toe, pain anterior to the medial malleolus, pain in the medial aspect of the knee, spasms and pain of the medial aspect of the thigh, dysfunctions of the genitals. With internal injury, there is an inability to have an erection. With injury by cold, there is a retraction of the genitals. With injury of heat, there is persistent erection. And that is actually what happens with Viagra. Viagra is too much heat, so that's why the erection persists. Separates from the primary channel on the dorsum of the foot, ascends to the pubic region where it converges with the gallbladder primary channel. So this is the liver divergent channel. It separates or divides at the dorsum of the foot, enters the external genitalia, connects with liver, gallbladder, heart, esophagus, eye system, and external genitalia, emerges at the mandible, which is the same as the GB, and then converges at the outer canthus, which is the same as the GB. Liver divergent treats muscle pain or flaccidity and pain, pulling sensation, and distending sensation of the external genitalia. So all that's about divergent pathology. That brings us to our first point, which is liver 1. Liver 1 is a Jing-Well and Wood point. It's the entry point from gallbladder 41. It's also the Harari point of the liver channel. And basically it's on the dorsal aspect of the big toe at the junctions of the lines drawing along the lateral border of the nail and the base of the nail, proximal observed 1 soon from the corner of the nail. There's our picture there. Directly across is spleen 1. The actions: regulates qi in the lower jiao, treats Shan disorders and alleviates pains, benefits the genitalia and adjusts urination, regulates liver qi and stops menstruation or menstrual bleeding, revives consciousness and calms the spirit. So when we see the phrase Shan disorders, that is what we call in the West hernia disorders or hernias. In Chinese medicine, there are 7 different types of Shan disorders that you're going to learn in your DTX series, I believe, urology. They begin to discuss the different 7 types of Shan disorders. Here's our indications. This one's really good for all types of Shan disorders, or the sudden Shan disorders. The 5 types of painful urination dysfunction. So this one has a lot to do with retraction of the genitals, swelling of the testicles, pain in the penis, things like that. This is one of your go-to points for that. As well as irregular menstruation, ceaseless uterine bleeding, all the uterine stuff, as well as epilepsy and loss of consciousness from one stroke. Brings us to liver 2. Liver 2 is the yin, spring, and fire point. It is on the dorsum of the foot between the first and second toes, 0.5 soon proximal to the margin of the webbing. So it's right there in the webbing. There's a little crease. It clears liver fire, spreads liver qi, pacifies liver wind, clears heat, and stops bleeding. Then it also benefits the lower jiao. There is our indications. These are some extra notes that I decided to actually add in for this particular lecture, which is the neuroanatomy. This particular lecture has an extra added component about neuroanatomy. Liver 3 is the shoestring and earth point. It's also a source point, and it's also the Ma Da Yang heavenly star point. It's on the dorsum of the foot in the hollow distal to the junction of the first and second metatarsal bones. Right there where the 2 bones make that V. And it's a very large point. It's about the size of a nickel, so it does a lot more. It spreads liver qi, subdues liver yang and extinguishes wind, clears the head and eyes, regulates menstruation, regulates the lower jiao, nurses liver blood and liver yin. As you can see, there's 3 additional slides just for the indications alone. Liver 4. Liver 4 is the Jing River and the metal point. On the ankle, anterior to the prominence of the medial malleolus in the significant depression just medial to the tendons of tibialis anterior when the ankle is extended. or dorsiflex by pulling the toes upward, right? Now, liver 5 is very, very close to our liver 4. In fact, it's very common to thread liver 3 to spleen 5 or spleen 5 to liver 4, whichever way you want to go. I use that combination quite a bit in practice. The next slide, this slide, is just about the reference. It shows you the kidney channel progression on the bottom, the spleen is in the middle, and then the liver is on top. And then it also shows you the different variations of the bones or locations of the bones versus the channels of the foot. So you have spleen on the outside, liver right there, stomach, gallbladder, and then finally UB. Actions. Spreads liver qi and regulates the lower jiao, calms the liver channel, stagnant heat or latent heat. And then it has a very long list of indications. Most of this has to do with some type of heat. Liver 5. Liver 5 is the low point. It's also the opening point of the liver divergent, according to Cecil Setzman. It's the meeting of the liver and the liver divergent. It is 5 sun above the prominence of the medial malleolus, immediately posterior to the medial crest of the tibia. In fact, the translation of the name of this point is called wormwood. And when you palpate that bone, you should feel this little cleft in the bone, half on, half off. So you always want to locate it half on the bone, half off of the bone. There's our little thing here. So you want to go 5 sun from the medial malleolus, half on the bone, half off. Spreads liver qi, regulates qi and benefits the genitals, clears dampness and heat from the lower jiao, regulates menstruation, and treats plum stone qi. Has a lot of indications. But the interesting one is the plum stone qi, which is that globius hystericus, right? Where that you oppress the emotions so much, you have this very sharp, or it could be dull ache in the throat. The other time you'd see this point used is fright palpitations. You're so scared you start getting palpitations. Liver 6 is the qi cleft. It is 7 sun above the prominence of the medial malleolus, immediately posterior to the medial border of the tibia, and a depression between the medial border of the tibia and the gastrocnemius muscle itself. Spreads liver qi, regulates the lower jiao, regulates blood, and drains dampness. Liver 7, posterior and inferior to the medial condyle of the tibia, 1 sun posterior to spleen 9. The easiest way to find this is find spleen 9 and go 1 sun behind, just as what my slide shows. Dispels when damp, benefits the knee, relaxes sinews. You're going to see this a lot for swelling and pain in the knee, pain in the inner aspect of the knee radiating to the patella. Liver 8. Liver 8 is the Hasi point and water point. Just superior to the medial end of the popliteal crease, in the depression anterior to the tendons of M. sembitendinosus and semibrosis, about 1 sun anterior to kidney 10. And there's a little thing there. I usually find kidney 10 and then roll back up to the inside to find that. It's actually a mirror image of the gallbladder point on the other side. It clears damp heat from the lower jiao, benefits the genitals, invigorates the blood, and benefits the uterus, nourishes blood and yin. Then we take a look at our actual TCM indications, and we see swelling and itching of the genitals, pain of the genitals, pain of the penis, all that stuff. Seminal emissions associated with sexual taxation. So it's all about external genitalia, and then we get about halfway, and it's all about urination issues, and then diarrhea containing blood and pus, no pleasure in eating, and then uterine prolapse, abdominal masses in women due to blood stasis, Jiangjia. This is actually one of your pivotal points for abdominal masses in women due to blood stasis. This would be your fibroids or your cysts on the ovaries, things like that. That's really what this point is about. Then we get into liver 9. Liver 9 directly superior to the medial epicondyle of the femur, forsoon superior to liver 8 in the cleft between the vastus medius and sartorius, located as one patella height above the superior border of the patella. Okay? Boom, right there. It's on the edge. The only thing it does is it adjusts menstruation. It regulates the lower jaw. Liver 10. Liver 10 is 3 soon inferior to stomach 30, which is 2 soon from the midline, level with the superior border of the pubic symphysis, or REN2, on the anterior border of the abductor longus. And there's our slide. So you can see the pubic symphysis, and then all the way across is liver 10 on the bottom, and then on the top is our liver 11. It only does one thing: clears damp heat and benefits the lower jaw. And the indications really are about local. They have a local effect on the tissue. Liver 11, too soon inferior to Chichiang, which is too soon from the midline, level with the pubic symphysis, REN2, that would be stomach 30, right? On the anterior border of adductor longus. And there's our slide again. And then it only does one thing: it just benefits the uterus. And the indications are infertility, irregular menstruation, pain in the inner thigh and knee. And then liver 12 is 1 soon inferior and 2.5 soon lateral to REN2 in the crease of the groin, medial to the femoral vein. The femoral artery is located approximately midway between the pubic symphysis and the ASIS. And then the femoral vein runs medial to this and is approximately 1 finger breadth in diameter. So you always want to try and palpate that, and then move. This is just a location to show you all the different things in that particular area. Eliminates cold from the liver channel and benefits the lower jaw. This is one of our best points for either a Schwann disorder or a uterine prolapse. Liver 13 is the front mu point of the spleen, the meeting point of the zong, and the meeting point of the liver gallbladders, and the origin of the daimai. It's also the meeting of the liver with the daimai, the gallbladder divergent, and the liver divergent. Directly anterior and inferior to the free end of the 11th rib, this point usually lies just above the level of the umbilicus, on or near the mid-axillary line. So we're going to use that same technique of you finding the tip of the elbow, lining up the side of the elbow, the tip of the elbow, which is the operculum, and it should line up right with that. Injury to the stomach. So injury to the stomach and spleen from overindulgence in eating, focal distension, pain of the abdomen, drum distension, or abdominal masses. And then liver 14. Liver 14 is the front move of the liver. It's on the mammary line in the 6th intercostal space, foresoon lateral to the midline. This is just showing you how to locate the rib spaces. It spreads the liver, regulates chi, invigorates blood, dispels masses, harmonizes the liver and stomach. And I believe that ends the lecture.